Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Hi everybody, you're listening to the Health and Wellbeing podcast from South Downs Health and Care with your host Dr. Nick Harvey. The purpose of this show is to help people understand how they can help themselves and others with their health and well-being. Every episode, I interview an everyday expert to understand the latest evidence and advice on how to improve your own health or help others. This week, I'm excited to welcome Nirmit Upadhyay. Together we'll explore the vital topic of managing chronic conditions through digital tools and lifestyle changes using digital health apps. Welcome. With an academic background in business and nutrition, Nirmit has spent the last 7 years in the world of digital health, exploring the principles of various behaviour change techniques and models using digital tools to improve health outcomes. Nirmit currently works as a senior business development manager at Liva Healthcare, a leading digital health company that supports prevention and management of chronic conditions. As an emerging leader in this space, Nirmit is very passionate about formulating global partnerships in creating digital health ecosystems that enable healthcare professionals to support people in their journey towards chronic care as well as prevention. Nirmit is a strong advocate of simplified transformation in healthcare and is on a constant journey of helping people's life fit, easy and healthy. Welcome, Nirmit. Yeah, thank you so much for joining us and coming all the way to sleepy Eastbourne.
Thanks, Nick. It's great to be here.
So, just to follow up on your bio, really, I'm fascinated to hear a little bit more about you personally. You started out life in Mumbai and found your way to London. Tell us a little bit more about that.
Sure. So, as an Indian boy, I was always born and brought up in India with the amazing Indian street food. Absolutely smitten by it. Can't change my mind. And I moved to the UK to pursue my further education and master's in marketing. And then I moved to London about nearly a decade ago. And ever since, I have been in the space of tech, fitness and digital health, which is where I spend most of my work life. And personally, I am very, very motivated by fitness and nutrition as, my personal passion about living and leading a healthy life. And that's where I'm in this world and keen to help and support people get fit, healthy and easier lives.
Fantastic. Thanks, Nirmit. And you were telling me before we went on air that you've even taken it upon your personal self to do some nutrition training as well. Yeah. Tell us about that.
So this got in a few years ago when, for everyone in their early career days in their life, they're always trying to do so many things. And for me, I was in that position where I was doing crazy hours working, not because I had to, but because I was ambitious, was excited. I wanted to do a lot of things. Then evenings, I would spend a lot of time socializing as well, because again, you don't want to miss out on some of these things as well in early days in your career. And all of these things got me to a position where I was starting to firstly compromise on my sleep. And that was one thing which, I would just let go. And it's very easy if you had to let go one chore in your daily life, the easiest is sleep. And it's also the most underrated, thing in a person's health journey. And I think that's when I realized that I need to balance out. And I started to, manage my sleep, but that was not enough. I would still be tired. I would still be fatigued. I would want to achieve so many other things, and I would look at social media and, all the people around me, and I would ask myself, what else can I do? What else can I achieve? It's always an addition to what you're already doing. And that got my body physically and mentally tired. And I started to read about lots of things, online, as, any millennial would typically do. And I started to come across so much unstructured information and education and articles about what you should be eating, how you should be sleeping, what you should be exercising. And at times I would find myself reading conflicting views and articles, especially in the world of nutrition. And that was my trigger point. And because my academic background's in business management and marketing, I never had a formal education in the world of healthcare. So, and despite having worked in the field for a long time, I felt that the education available, there's a lot of education, don't get me wrong. There is a lot of information out there to support people in their, journey towards being healthy. But for me, that information was very unstructured and conflicting. And that's when I, said to myself, look, I got to learn something to understand what impacts your health. And the basis for that was nutrition. So I went on and got a professional certification in supplement advisory a few years ago. And that then sort of opened my eyes to understanding and uncovering the world of health education in general. And then I've gone ahead and, created a few of my own personal models of personalized nutrition where, people can input in certain sets of information about their health, lifestyle, well-being, and their goals. And this sort of model would give you an output of what is an ideal macro and micro content of nutrients like vitamins and minerals that you can be consuming on a daily basis. And again, this is something I've been doing in my own health journey to, stay fit and healthy.
Amazing. Thank you for sharing that. Intrigued because I want to ask you, what are the top 3 kind of tips then that your take homes are in terms of nutrition? But hold that thought for a moment, because then you also touched upon how personalized that is for every single person. And that's the key here, isn't it? I think that everybody's different. Everybody's got different needs. And I guess to some degree, everybody needs to go through that educational journey for themselves, but you've made that a bit more simple. So fascinating.
Absolutely. I think personalization is probably the talk of the towns in the past half a decade. And I think a lot of digital health companies are doing some amazing work in personalizing interventions, personalizing functionalities, personalizing support and care planning that, individuals and patients get as part of their care journeys. And for me, if you ask me how you break personalization down, I would say it's broken down in three steps. First is you go as a patient, you go identify what are your challenges, what are your problems. This can be identified by yourself or by speaking to a friend, family, or healthcare professional. Second, once you've identified the challenge, is identifying or finding routes and ways to resolve that challenge, which again should be consulted with your healthcare professionals or your GPs. And third is finding a platform, a way, a method, which can be a digital intervention. It can just be taking a walk in the park or visiting a family member. And those are sorts of the 3 stages in how you can personalize every journey, because every journey is different. You can personalize interventions, but you can't personalize journeys. And I think personalizing journeys for patients is very important. And I think there's a lot of work going on in the world of digital health where lots of organizations are creating custom patient pathways and journeys to support people live healthy lives. So yeah, that is my take.
Thank you. Thanks. So we've segued into digital now, because it's a fascinating way, I think, of doing that personalization element, isn't it? So you've just talked about personalizing the way you understand what goals might be, personalizing the way you set those goals and achieve those goals, and achieve a kind of a coaching approach to achieving those goals. And of course, using people to do that is really expensive and sometimes not as standardized in terms of its approach to personalization and things as you might think, is it? So tell us what are you thinking about the digital landscape and how it's going to help us in the next decade?
I think digital is definitely an enabler to personalization, but the two ends of the stick will still remain healthcare professionals and patients. Digital is that, joining bridge. It's bridging that gap, is that stick which has got two ends. And I think how much ever personalization digital and, AI, generative AI can provide, based on data available, there is still going to be data and information which is offline, which is in the moment, which is in the future, which cannot be predicted. There are many predictive algorithms and, AI mechanisms out there, but there is so much that digital can do. My hunch is that healthcare professionals and patients always will be at the forefront, who are then understanding the existing lay of the land and being able to recommend what is the best possible outcome for a particular patient based on, obviously, the predictive analytics that digital is providing, but at the same time be in the moment and look at what the patient can realistically achieve. That is where, the crux of personalization lies for me.
Mm-hmm, mm-hmm. So what are the common misconceptions that you see people having around using health apps and digital tools?
So the first misconception is one in your question itself, which is digital apps. And I think many a times people mistake digital support as a mobile app. Yes, mobile apps are one of the major things that you get as part of digital support, but digital interventions are much more broader than that. And I've been on the backseat of creating digital journeys and pathways where mobile app is a carrier to deliver some of these interventions. But to give you some examples of other digital support and pathways which are created for patients include a backend system that connects your NHS data, your GP records into the app that you're getting intervention through. There is a platform for healthcare professionals who are sitting behind that mobile app and giving you that, virtual remote support. There are virtual SMSs that you also get, which are part of digital interventions. There are signposting to local community-based assets if you're recommended a local service. That is a digital intervention. Although you're performing that, doing that face-to-face with someone, that is a digital recommendation. So there are many set pieces that amalgamate into a digital intervention. And I think one of the major myths, like I started, is people think digital is just a mobile app. It is not. It is much more than that. Mobile app is what you get as a companion to help you in that journey, but digital should not be mistaken. So that's one. Second is digital apps are always powered by AI. That is another misconception. There are many, many digital apps out there who are being powered by healthcare professionals. Healthcare professional clinicians are sitting there to firstly create those apps so that they are safe for patients. And secondly, there are many apps where clinicians are sitting behind having that one-to-one messaging or chat or conversations with you. There are these personalized goals and resources and information which is being shared again by certified healthcare professionals who are giving and recommending you those sets of support services. So I think that is second, where AI, people think if I'm getting an app, I am being shooed away by a healthcare professional and they don't have time enough to come and help and support me, but that is false. So that's second. Third is mobile apps and digital are suitable only for younger patient population, and that is false. There is a lot of work that goes behind. Again, NHS DTAC, DPIA standards require mobile apps to be accessible and accessible by elderly patient populations as well. So mobile apps are not just for younger patient population, it is also for elderly. There are mobile apps which are created also for family members and carers, so that if the person is absolutely not able to use a smartphone, there is a tablet app, there is a web app which is also provided to carers and their family members who can help support in their journeys. So that is another misconception where people assume that the apps are just for younger people. Number 4 is apps can only be used for monitoring and tracking progress, and mobile apps do much more than that. the first ever thing a mobile app helps a patient is in their journey in understanding their chronic condition. Because many a times, let's say at the age of 40 as a patient, you are diagnosed with CKD or type 2 diabetes. You're not aware of what the condition is, what it will do to your body, how it is going to change your routine and daily life. And that is the first bit that digital health apps help patient to do, is understand your condition, understand what it is that is going to impact your life, and then be able to train them and make them able to self-manage their condition on a daily basis. Because let's be real, we don't want to be dependent on an app for the rest of my life, right? So that's another thing that people assume apps just allow you to monitor and track your weight and steps and sleep, but it's much more beyond that. It allows you to connect with your healthcare professionals when you're outside clinical environments, right? So if a patient is visiting a GP for, say, a 15, 20, 30-minute appointment, for the rest of the year, they are not seeing the GP. That is what the app helps them to connect with their GP. That is what the app helps the GP connect and understand about the patient progress. So that's another misconception. And one of the major misconceptions which I want to talk about is, and I've had this myself being a digital geek, is people expect results immediately. Digital health apps will not give you results within a week or two. These are behavior change mechanisms that you will need to bear in place for a longer time. The NHS central programs like the type 2 diabetes remission program is a 12-month program. The National Diabetes Prevention Program is a 9-month program. These are longer-term programs where you have to commit to the journey. You cannot be expecting, to lose weight and BMI within a couple of weeks of joining an app. It's not instant. It requires commitment, conviction. And I think that's what is very important when you're looking at or when you're starting your journey with digital apps. This is one thing I would say to patients listening in is, don't expect instant results. Commit to the journey. You will get there. You will be there, but don't expect instant results. So that's another, I think, a big myth which might be, never considered at all.
Thank you. Yeah. Behavior change is always difficult, isn't it? When I'm listening to you there, I'm hearing two kind of themes emerging there. This is around empathy. So how do we as healthcare professionals best understand the people we serve, and digital technology can really help us there. And then empowerment. How do we empower individuals to make those changes and to understand their conditions the most? Digital technology serves majorly there, isn't it? I think empathy and empowerment are huge kind of tags for digital healthcare. Really.
Absolutely. And I think there is a very interesting concept in the many models of behavior change there is one technique, one common technique that a lot of therapists use with their patients is cognitive restructuring, which you might or might not have heard of. And that basically speaks about understanding, because in reality, you always know the data. You know what the patient has been on in terms of medication. You know what their, HbA1c, BMI, weight, blood pressure, etc. Their sort of health matrices are. But what you don't know is what's stopping them in achieving these goals. And that is cognitive restructuring, is to understand what are the blockers, what are some of the pitfalls where patients are unable to achieve, and the reasons behind them. And I think that's where a lot of healthcare professionals are trying to understand that, as an addition to the personalization that digital offers, is to understand, what are those blockers, what are those pitfalls, so that they can, support the patients accordingly. And that is what digital allows them to do. Digital allows patients to report those pitfalls and blockers and barriers. And it allows healthcare professionals to understand what's really happening, what's really stopping the patient in achieving these goals. If I can give a simple example of a 12-week weight management program, right? A tier 2 weight management program that a lot of patients are on typically. 6 weeks into the program, you have completed every single action and task that your healthcare professional has, or the digital app has suggested you to do. Ideally, based on the efforts, you should have lost half the weight of your target that you've set for those 12 weeks. You should have lost half the weight because you're halfway through the program. But you haven't. You haven't achieved the outcome, but you've put in 100% of the efforts. And this is that relationship between effort and reward, as we call it, effort-reward relationship, is the difference between what you've put in and what the outcome has. And that is where cognitive restructuring comes in, where you're trying to understand for the past 6 weeks, what has the patient done and what has stopped them, what are the barriers in achieving the loss, so that you can, for the next 6 weeks, you are then able to tailor the digital interventions that they get based on the understanding of the pitfalls and barriers that they faced in the recent past. So that's one very interesting point to bridge that personalization through digital interventions.
Fascinating. So it really isn't just replacing the human, it's enhancing the whole journey for somebody.
Absolutely. It's all about enablement. I think digital is there to enable healthcare professionals, is to enable patients. It's not about replacing a healthcare professional, but sometimes it, gets misinterpreted by healthcare professionals as well as the patient, which we spoke about just now. And I think digital healthcare should be taken as an enabler to improve outcomes, achieve success.
Thank you. So when it comes to lifestyle changes, you've highlighted again that it's going to be personalised. It depends on, a lot of cognitive restructuring. But are there any particular small achievable steps that in general individuals can take?
Absolutely. So I think I'll talk about a few mechanisms, commonly used techniques in the world of behavior change, so to speak. The first one is goal setting. And this is very common. Everyone will have heard of SMART goals, right? Smart, measurable, actionable, realistic, time-bound. It's a very common technique used in not just healthcare, but in quite a few domains. And goal setting is very important because it brings to the table what you want to achieve and where you want to go, both for patients to know where they're going and for healthcare professionals to understand what they need to support the patients with to achieve that specific, goal in mind. And I think goal setting also helps you to then stay on track and have accountability towards either yourselves or your health coach who is supporting you in achieving these outcomes. And this is the most basic technique used by most cognitive therapists, health coaches, dietitians, nutritionists, in penning down what you want to do. So to give you an example of a SMART goal can be lose 3 kilos in 30 days. That can be a SMART goal for a patient. And then you have actionable insights to understand what you're going to, do on an everyday basis to action some of these things. And then to give my previous example, after 6 weeks, you have a touch point where you're then trying to understand what of the 10 things in your action plan were you able to do, what were you not able to do, and why were you not able to do that. So that's where the whole concept of goal setting comes into picture. The second concept I want to talk about is community social support. And in this journey, right? Because these are longer journeys. It's not like a couple of weeks and you've achieved your outcome. And in these journeys, it's very important to be with someone. You're walking longer. You're not walking faster. You need to walk with someone. And that walking with someone comes when you've got a community, a peer support, a social support group of people like yourselves who are going through the same journey, where you can talk about it, where you can talk about your barriers, your challenges, the success that you have achieved from doing X, Y, and Z. And if I can speak from a COM-B behavior change perspective, which is capabilities, opportunities, and motivation, that motivation element is quite significant in here, where people are very motivated when they're doing something, when they're achieving their health goals as part of a group, as opposed to, being alone on that journey. And many a times people leave the programs midway because they're not they're not seeing the progress enough, or they're not seeing people like themselves do a similar thing. So you might feel very lonely at times if you're, on these programs all by yourselves. So I think community, social, buddy up, as they call it in a lot of these programs, is very essential, and quite a good step one can take. The other thing I want to talk about is gamified reinforcement, which is again positive and negative reinforcement delivered through digital. And this happens through nudging, reminders, and notifications, as we might see in mobile apps, right? And this is one very interesting concept, that some of the health apps that you might see out there who are doing really well because of the gamification they have within the app. And that is very important, one, from a retention perspective, that patients are not losing interest in the program through the digital app. But at the same time as retention, it also is very important in enforcing some of the action planning to the patients, right? So many times what might happen is you might create an amazing plan with the patient, but if the digital app is not supporting enforce those actions, then it is a wasted opportunity. The patients are not going to improve, even though the plan is really amazing. And that's where positive and negative reinforcement comes into picture, where you're complimenting someone, as simple as like a leaderboard system in an app, where people are then trying to push each other in that community space to try and up the ladder in that little group or cohort, which is positive reinforcement to some. And negative reinforcement can be where, if you do not achieve a particular action for, say, a week, your goal resets. And that is negative reinforcement for some, where they're like, I could have done it, I lost it. So, the reinforcements are very, very important in the way they are structured. And that's where gamification through digital comes into picture, where you're gamifying those reinforcements, and in a way that, patients are more self-motivated to achieve some of these goals. So I think those are some of the things I think individuals can look at in terms of, improving their overall health. Another thing I'll speak about, which is very close to my heart and in the world of nutrition, is behavioral substitution, which is basically swapping healthy alternatives for a particular snack. And there are many leaflets and, articles that the NHS has created, which are really interesting around different food swaps available for different cuisines, different ethnicities, different geographies. And I think that's quite a popular, piece that lots of nutritionists are recommending to patients, particularly from a diet change standpoint, to have that behavior when they're at their home, when they're in the supermarket, when they're shopping, when they're, out at a restaurant, when they're out at socials having, drinks with their mates and so on. So, behavioral substitution is another very, very small, but very significantly impacting technique that I would recommend people to use.
Thank you. Blimey, you can understand why digital technology can help people, because it's actually really complex. There's a lot of things that we need to pick up on. And I think the landscape is also complex when choosing what platform you might want to help you. So are there any tips you've got there? So what should people look for if they're looking on the App Store or more broadly on the internet for tools that can help them?
So I think from a patient standpoint, when you're looking at digital tools and support available, the first thing you should look at is if there is an MDT support. And when I say an MDT support, it's a very fancy term, but I'm going to break it down into, simple language. So MDT is multidisciplinary team members of healthcare professionals who are orchestrating your support. And as a patient, when I'm evaluating a digital tool, I want one tool to support all my needs. And that means when I'm speaking to my nutritionist, when I'm speaking to my health coach, when I'm speaking to a dietitian, when I'm speaking to a talking therapist, when I'm speaking to a physical activity coach, and when I'm speaking back to my GP, all of this information needs to be in one place and orchestrated by all all of my healthcare professionals at the same time, so that I am not having to repeat this information and the care is not duplicated. So, for example, a GP, when I visit my GP might give me a care plan and also recommend me to join a weight management program provided externally. Now, when I join the weight management program, the health coach and the nutritionist are going to recommend me certain sets of actions. Now, I have two sets of action, one from my GP as part of my care plan and one from my health coach and the nutritionist as part of their program. Now, for the next 10 to 12 weeks, I have two plans in one, and my routine does not allow me to, full-time manage my care. I have, a 9 to 5 job. I have a social life. I have a family. There's so many commitments a patient has, and it's very important to have that integrated orchestration. So I would insist, have a look at what that MDT approach is. You can check for if the app is integrated into your patient records, if the app allows multiple healthcare professionals to view your data, if the app allows you to have full access over your data, where you can, transfer the data externally and share it with someone else. So that's the first thing I would recommend. Look at if, multiple healthcare professionals can support you through the app. The second thing I would suggest is look for patient data safety. And again, data safety is quite important. And I emphasize this is because many a times in the fine prints, as a patient, we don't realize that you have limited access over your data. You have limited data rights. And when I say that is simply because your data is stored and saved in a secure cloud server, for example, through the digital app that you're using. But that does not necessarily mean when you're ticking the I consent box at the start of, downloading a digital app, it does not necessarily mean that the data can be downloaded and transferred wherever you want to take that data, because it is going to be your data for the time that you're going to be using the app. So I would suggest look at what the app allows you to do with the data, i.e., say after 3 months or 6 months of completing that program through the app, you should have that ability to take that data and transfer it to your GP, transfer it to your private healthcare professional. Wherever you want to take it, you have that ability to take that data with you. So that's second. And third, and the most important, I think, is flexibility in personalization. And I say flexibility in personalization is because most health apps out there will claim that there is personalization element, but that flexibility in personalization is what matters. So try to understand what that personalization is, because personalization is a very broad term. Personalization can mean that you are given a custom care plan just for your condition, which is diabetes. But within diabetes, if you're a South Asian, if you're a male, if you're above the age of 50, your personalization will differ to a great extent to just a type 2 diabetes plan, right? For example. So I would urge you to understand the flexibility in personalization that is available through the app, and not just go on the marketing materials where, digital apps claim there is personalization. So yeah, that is one major thing I would urge you. Otherwise, just commit once you get in. Evaluate your options properly. See what's out there. Talk to people, talk to your GP, talk to friends and family. But once you select what you've done, please don't back out. Commit to your journey, because it's your journey and you go walk your own walk. So commit to it and you will come out victorious.
Sound advice. Thank you. It also makes me think of some of the programs that you see advertised that will, claim you'll lose 10 kilos in a week or whatever it is. And I think if it sounds too good to be true, it probably is, isn't it? And we can help with these journeys, but equally there's still going to be a challenge, aren't there? And I think it's around finding where you're going to get the right support for that challenge you're taking on.
Yeah, it's about finding the most suitable support for you. And as part of standard of care, right, that GPs and healthcare professionals deliver, you need to make sure that the program is embedded within standard of care rather than being a standalone program that you're doing outside what you're being supported with by your GP or by your healthcare professional. And make sure that, it's segued into your care journey rather than being a standalone support that you take.
Thank you. And then pivoting to the healthcare professional, because you've referred to them quite a lot. How do you see their role in using or supporting people using digital health tools? How do you see that having to change in the future?
I think absolutely. I think healthcare professionals are going to have a more joined up approach in how they support patients, and digital is going to be at the forefront of that joined up care. And I think the way the sort of trajectory in digital health landscape is shifting from individual standalone apps as part of the wider healthcare ecosystem and infrastructure to being now one-stop shop. So the NHS app is in itself a very good example, where initially it was just used to have your care records, but now it's moved much more from just being a care record app. It is centralized a lot of prescriptions. It has centralized a lot of your medications, your care plans. You can communicate centrally with the NHS team around some of your care challenges. You can input your barriers and blockers that might be hindering your care journey. You are able to track and monitor some of your, key biomarkers. You are able to view test results. There are lots of changes coming in the NHS app as well, where, previously it was decentralized, and now it's, taking a joined up care approach. And I think a lot of as a patient, one might not see what's in the face of it in the front end, but there are many back-end technologies, many digital systems and apps who are powering the front-end system that patient interacts with. And that's where I think the sort of future lies, where healthcare professionals are going to be orchestrating that joined up care as opposed to providing care in a siloed approach.
Thank you. Thanks. So what we haven't touched on yet really is the inequalities that exist in healthcare. So by that I mean, we know that people have poorer health outcomes if they're in a household with lower income. We know that ethnic minorities have poorer health outcomes, people with learning disabilities. What's going on in the digital health sphere to tackle that?
So I think in terms of addressing inequalities, there's a couple of parameters to it. First is understanding the patient demographics, which is your ethnicity, age, gender, location, all of that. So the public health in the UK has created something called as a PDS, which is where population level demographic data is available for digital health companies to understand what region is facing certain types of inequalities based on the population demographics in that region, such that you are able to cater your digital health support in a way that, helps the population in that area. So that's the first at a population level, what changes are coming in. And we've seen quite a few digital health companies in the UK adopt the PDS created by the public health here. Second is personalization. And I think a lot of digital health companies are personalizing interventions. And I don't mean personalizing the data that they capture, but personalized interventions based on that demographic data that they have received. So let's say, for example, if there is a patient with type 2 diabetes in their 50s, male, South Asian, right? This is the demographic information that we have. Now, we might have quite a few other personalized recommendations around their medication, around what they want to achieve, what their blockers are. But where this personalization goes is to understand their daily behaviors. So this is a learning mechanism that digital apps understand how patients are reacting. Now, this information cannot ever be predicted by any AI or any healthcare professional. It is an ongoing learning curve for the digital system to understand how the patient is engaging with the digital app, and then, appropriately recommend relevant interventions. To simplify this further, give you an example. When a patient is not engaged with the app for almost a week's time, but at the end of the week, they have inputted their weight and they have lost 0.5 kilo. That is progress. So the app is going to learn, and second week, it's not going to send the patient daily notifications, because they know daily notifications will put off the patient. It'll trouble the patient. We'll send a weekly notification because the patient is self-motivated and they're adhering to their weight loss plan, for example, as opposed to someone who is engaging with the app on a daily basis, but not inputting in their markers, or is not improving towards their health goals. The app will then start to learn around what possible scenarios or interventions there can be to support this patient, which could be sending them daily notifications, which could be recommending them a relevant article, sending them a video of a success story from one of their peers if they're looking at the community leaderboard every day. So, these are sorts of some of the things that the app understands and learns as the user behaves on the digital platform, and then is able to recommend them relevant things. This is where personalization in behavioral dynamics comes into picture, where people are starting to engage in behave in certain ways with the digital platform, is when the app will then be able to recommend them personalized interventions. So that's what I meant earlier by personalized interventions to patients.
Sure, thank you. And this leads me on to a question that was posed by our previous guest, Robert Ralph, is I can understand how if somebody registers on an app and starts to use it, how we can tailor and ensure people who are traditionally suffering inequality get a more tailored, better service. But what about the people with a reticence to engage in the first place, especially older people? Is there anything that we can do to kind of overcome that reticence to use technology?
Absolutely. And I think, and this is my personal belief, right? I don't speak on behalf of anyone, is that if a person does not want to use technology, don't give it to them. But at the same time, we want digital to support that we want to use digital to support that patient, right? So as a healthcare professional, you still want to be in a position where you're using digital, but the output to the patient is not digital. Sounds unachievable, but I've seen in the past where organizations have created offline materials. To give a simple example, right? The care plans that GPs create in your care records is typically sent to patients, as part of a mobile app, SMS, a web link to something. There are a few other examples where digital health companies have created personalized video messages where the patient is, rather than, playing with a smartphone and a mobile app, they are just getting a video which can be viewed on their TV, on their tablet, on their mobile phones, on their laptops, any devices they have, which is personalized to them. So there is a person in that video addressing Mrs. Jones. There is a person in that video talking about Mrs. Jones' health objectives. The person is talking to Mrs. Jones about what was the action plan they discussed with their GP. It is all very personalized. There are lots of, again, AI tools and systems being used to create such personalized video messages for patients. And these are, again, very interactive animated videos, which are 2 or 3 minutes long. So the patient is very engaged and they're actually having that pseudo interaction with that video. So that's one example. Second example is for people who absolutely don't have, mobile devices or devices at all to even watch a video in the first place. So for them, there are personalized printouts where, in the form of a 1-page PDF, that the GP can hand over to them right after their care planning appointment is all the lists of information around what they need to do on a daily, weekly, monthly basis, what local services within their area, including the phone numbers and contact helplines, can they contact to, at what point in time in their care journey do they need to contact, etc. There is a personalized printout which the person just, keeps, adds a fridge magnet on their fridge, and they can view that on a daily basis rather than, having mobile apps. And these can be personalized on local languages. So if a person speaks Urdu or Bengali or Hindi, right, you always have these in multiple languages available as well. So there are multiple such tools where if a person is not interested in using an app, as part of behavior change mechanisms, firstly, you should not force them. But secondly, I don't encourage you to put that off the shelf. And as a healthcare professional, I would strongly recommend to suggest people still use digital apps and so on. And I think the first method or the way to do that is demonstrate it. For many people, they are very hesitant in the fact that they might not be able to know how to use these apps. These apps might be very difficult to navigate. They don't know what to do about it. They don't know how to track their weight, the steps there, how to read an article. There's many of these different things that they might be scared about, but not, open to sharing some of these things. And I think that's where, as a healthcare professional, if you can demonstrate how to use the app, I think patients will be very keen. And I've seen that in the past where GPs have actually sat with the patient for a couple of minutes and shown them after the care plan, they've shown them how to use the app. The patients are very open to using it, and many of them have gone ahead and, used these digital apps. So, yeah.
Thank you. So don't force them, but take them on the journey.
For sure.
Yeah. Thank you. So it's been fascinating talking to you. Thank you, Nirmit. In our next podcast, we're going to be joined by Nick Harvey to discuss strategies for integrating key wellbeing practices into everyday life. So actually fairly aligned to what we've been talking about today. Do you have any questions to ask him?
I think one question would be to understand how you would do this at a population level as well as at an individual level, because the two are quite different frameworks, and how could the two frameworks potentially be joined up is what would be keen to explore and understand, get his views.
Thank you. I'll certainly pose that. Thank you so much for joining me today.
Thank you, Nick. It was amazing.
You've been listening to the Health and Wellbeing podcast, where today's focus was on chronic condition management using digital tools with Nirmit Upadhyay and me, Dr. Nick Harvey. For more information and resources, check out our website, sdhc.org.uk. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Join us for our next episode, where we'll be discussing wellbeing practices with Nicole Hartley. Please take a moment to subscribe and to help support us in supporting others with their health and wellbeing.